Tonight, nurses are sounding off about the CDC's decision this week to cut the quarantine in half for people who have COVID but who are asymptomatic. The president of the largest union for nurses in the country spoke with On Your Side's Kaylee Tracy today, one-on-one, about her message for the CDC director about this big change.
As nurses, we were so appalled, so concerned, and so disgusted.
Zenny Triunfo-Cortez, president of National Nurses United, says the CDC's decision Monday to cut isolation times from 10 days to 5 if you're asymptomatic will prolong the pandemic.
There will be more transmissions, more illnesses, and more deaths.
According to the CDC, people are most infectious 2 days before symptoms develop and 3 days after. So if you're asymptomatic 5 days after you test positive, the CDC says you can return to normal activities, but have to wear a mask for 5 more days. Triunfo-Cortez says the CDC's decision was focused on business and getting people back to work.
I asked them, our government officials, Dr. Walensky, and the public, would you like to be cared for by a COVID-infected nurse? Of course not. You don't want to get sicker. You want to be in the best of health. And the only way to do that is for nurses to stay home when they're infected with the virus, with or without the symptoms.
CDC Director Dr. Rochelle Walensky defended the decision.
It really had a lot to do with what we thought people would be able to tolerate. We have seen relatively low rates of isolation for all of this pandemic. Some science has demonstrated less than a third of people are isolating when they need to.
Triunfo-Cortez says the union is asking the CDC to reverse the decision. Kaylee Tracy, First Coast News, On Your Side.
Kaylee, thank you so much.